Welcome back. Botox or Dysport? Do you know which of these line erasers to choose? Have you even heard of Dysport? I hadn't. Dr. Alexander Ataii is here to tell us the best way to give your brow line a boost, depending on the results that you're looking for. Thank you so much for coming on today.
Thank you for having me.
Okay, so first of all, Dysport, you were saying, is giving Botox a run for its money, and it's only been here and approved in the U.S. for 4 or 5 months.
That's correct. You know, Dysport has been around in Europe since 1991, but in the United States, the FDA scrutinized the product and finally approved it in April of 2009.
Well, what are the differences? I guess we can start there, you know, because people are looking for ways to appear younger, to get rid of some of the lines and, you know, the worried looks on their faces. But you were saying that some people are a candidate for Dysport and some are not.
That's correct. You know, with Dysport, the reality is that this product is giving Botox a run for its money because the nature of competition allows us to have a patient choose what they want to use. The amount that is used, Dysport requires 3 times the amount that Botox will. Usually in between the eyebrows, Botox requires anywhere from 20 to 30 units. Dysport is going to require more like 50 to 60 units. So there's a 3-to-1 difference between the Botox and Dysport. In the forehead or frontalis muscle with Botox, anywhere from 10 to 20 units depending on the individual, and with Dysport, slightly higher. But the challenge with doing the forehead with Dysport is that it kind of spreads a little bit more, so you can create more side effects with Dysport as opposed to Botox.
So just looking at what we just saw on the screen, it would seem, oh, well, you don't need as much with one, maybe it's going to be cheaper, but what you were saying is it really kind of evens out in the wash.
It does. I mean, depending on the physician that's performing the procedure, the cost can range anywhere from $9 to $16 a unit for Botox. Dysport can range anywhere from $4 to $7, $8 per unit. But because you have to use 3 times the amount, the reality is it's going to end up becoming almost the same.
Okay. We've got some Botox pictures that we're going to pop up on the screen, and the before and after. You know, it is amazing how much less stressed, how much younger somebody can look when you get some Botox.
The reality, yeah, absolutely. What you'll notice is this is a picture of a Botox patient, and the before and after, people will say you look less fatigued, you look more well-rested, and anyone between the age of 18 to 65 can benefit from this.
Absolutely. So this is a Botox.
Yes.
And tell me about this picture.
This is a gentleman that also received Botox, and in this situation, this is what we call the glabellar lines, and it creates this worried frown, if you will, and we can eliminate that frown.
Good, good. So there are things that you can do. And as far as the forehead, you're saying that sometimes with Dysport, that can spread more quickly. It
can spread to... Actually, the onset of action can, some studies have shown, be a little quicker with Dysport, but as far as longevity, it's very difficult. That previous patient was a Dysport. This one is a Botox. You see that within 7 days, those worried lines are gone. Wow.
Okay, so we are seeing a noticeable difference there. Maybe we have some more pictures with Dysport just so we can kind of get a contrast.
Because Dysport is new, there is not as many pictures. We have more Botox pictures, and a lot of physicians will choose to use Botox more than Dysport because of experience. This one is a Dysport again, and
Yay, Dysport picture!
And you'll see that there is a difference between the before and after. However, you'll still see that it works on dynamic movement and not static. And what that means is that when muscles contract, that's dynamic. If you're looking at me without any facial movement, that is static. And those sometimes require a wrinkle filler, such as Juvederm, Restylane, so on and so forth.
Got it. So finding out which one is best for you, not just going on price or going on units, it's so important to come in and have a consultation.
Absolutely. We offer at Laser Clinique complimentary consult for every patient that comes through our door. They meet with me, and then they'll see which product they will benefit from once I see how the muscles are moving. We're located in Carmel Valley, and we do have a first-time patient promotion going on. But the reality is since I do all of the injectables myself, I get to let the patients choose what's the best after they've thoroughly understand the product.
Thank you so much for coming on and explaining some of the differences. One quick thing, you were saying if there's any dairy allergies that Dysport is not for you.
Cow milk allergy.
Cow milk.
Cow milk allergy, and they cannot use Dysport.
Okay.
Okay.
Glad that we cleared that up.
Absolutely.
Thank you so much, Dr. Ataii, for
Thank you
coming
for
on
having me.
today
I
and
appreciate it.
setting us straight with the Dysport.
Thank you.